Hey, welcome back to Now and Then, the podcast where we talk about what's happening in the natural, organic, and wellness industry right now and what it means next. I'm Lindsay Walker, VP of Marketing and Communications.
And I'm Ashley Cornell, Director of Regulatory Affairs and Policy.
So this month, there are a few shifts that we've been watching that are starting to connect in a bigger way, and they're beginning to reshape how people think about food, health, and wellness. So today, we're digging into three things we're watching really closely right now: the ripple effects of GLP-1 drugs, how policy, especially around school food, is evolving, and how the definition of food safety itself is starting to expand.
So let's start with GLP-1s because this one's come up in a few conversations recently. From your perspective, what are you seeing in terms of how this is actually changing our sector?
It's a big one that doesn't seem to be losing any momentum. And there was actually a really interesting article this week about how much momentum the use of these drugs is gaining and the impact it's having on health, culture, industry, and even services like restaurants. I think it's those last two that move it to a new level. It's not just a healthcare story anymore. It's becoming a story about spending and consumer behavior. So I want to focus on our industry, obviously, and this idea of a wellness wallet. And this is really about where people are reallocating spend away from things that don't support their goals towards products that do. And these are things like you and I've talked about quite a bit on this show. They're pretty core to our industry. So things like more protein, more fiber, less sugar, less alcohol. The shift is not just about eating less, which we're definitely seeing, but it's also about eating better.
How quickly is this shift happening right now?
I think it's moving faster than a lot of people expected. To set the stage on usage, at the end of 2025, Maclean's was reporting that 1.5 million Canadians were on a GLP-1. By the end of March, that number has jumped to 3 million. So that's about 9% of Canadian adults. Coming back to this eating better mentality from a product perspective, we only have US numbers and they are a bit lagging, to be honest, but it's being reported that US protein beverage intake among GLP-1 users jumped 38% in 2024. So you're really seeing this tangible shift in, what people are actually buying. And I would assume it's a lot bigger nowadays as well. I think what's becoming clear too is this isn't just an individual behavior shift. It's happening at the household level. So even if one person in the family is on a GLP-1 medication, it starts to change everything around how food shows up in that household, how meals are getting planned, what's getting purchased, how food is being prepared, and even how other people in the house who might not be on the medication are being influenced to think about their own health and wellness goals. And so you see portion sizes shift, you see product choices shift, and you see value shift. Over time, those habits, again, they start to influence everyone at the table, and that impact grows and grows and grows.
That's really interesting. So 9% is more than I realized, to be honest.
Me too, yeah.
But you also make a good point about how even outside of that 9%, those people are still being influenced by that 9% because of how things in meals are prepped and shopped for within a household. It's especially interesting because it starts to expand the size of the opportunity here pretty quickly for brands in our sector.
Totally. I think that's where there's still a lot of white space. We're seeing some early adaptation, especially around protein forward products. I think protein is everywhere now and better for you options. I think there's still a gap when it comes to products that are truly designed to meet these changing appetites and eating patterns. So again, smaller portion sizes that still feel satisfying, more nutrient dense functional options, and formats that make it easier to eat differently without feeling restricted. Like if you do want to maybe indulge a little bit as well. And I think that's where brands in our industry have a real opportunity, not to just to respond, but to lead as well.
It kind of feels like this connects to something that we've been hearing about, which is the move away from calorie counting.
Yeah, I think this is an interesting one, that calories are losing relevance in the way people measure health. We're seeing a shift from eating less to getting enough protein, enough fiber, enough nutrients to actually support how you feel and what your body needs to stay healthy. And that's changing how products are being positioned. It's less about low calorie and it's more about function. So does this support energy? Does it help me feel fuller longer? Does it support my digestion or my blood sugar? And Even things like texture and satiety are becoming more part of the value proposition because people want to feel good about what they're eating.
From what I've been hearing, even outside of any research, is that even if people are trying to reduce or maintain their calories, more people seem to be finding ease in restricting their eating window in a day rather than counting calories. So you have those people that aren't worried about reduction or restriction and want to make sure they're getting enough nutrients. But even those that are wanting to reduce, they're not doing it by calorie counting. So either way, it sounds like people aren't calorie counting these days. So that it's really changing the way people define like healthy eating altogether.
Right, like fasting, counting macros, it's a different way of coming at it, even if it's kind of the same goal in mind. We're moving away from this idea of weight that's something that's driven by discipline to something that's more biological. You can
Mhm.
control it through medication or your hormones. And I think that's really opening up a different conversation. Again, it's less about restriction and it's more about supporting your body. I think what we're really anticipating as we look future forward is more of a focus on metabolic health, resilience, mood, sleep, and these are the things that are going to resonate with consumers.
Yeah. And when you think about all of these shifts, what people are looking for, how they are shopping, it can be exciting for brands. It's a good time to adjust to these changes, really.
Change creates opportunity, and especially for early stage brands who can be really agile in responding to consumer demand and act quickly. Often they're closest to what behavior is changing and where it's actually going. But I think that brings us into policy because all of this evolution and this change in what healthy means as it evolves on the consumer side of things, policy tends to follow. And so I know one of the topics you were tracking was this movement around the food school programs right now. So what's driving changes there?
Yeah, this is a neat one. It's a bit different from what we typically cover, and it's happening globally. So school food programs are increasingly being used as public health policy tools, which it makes sense, right? Start the influence young, and over time allow that to impact population health. So we're seeing it globally. In the UK, they're tightening standards. This looks like limiting fried foods, requiring healthy ingredients. In the US, there's more focus on reducing added sugars. And then in Canada, the National Food Program was made permanent. So this happened last year. And then just last month, the federal government signed bilateral agreements with provinces, territories, and Indigenous partners. Canada's approach is, I would say, less prescriptive than what we are seeing elsewhere, but it's still aligned with those same trends, focusing on improving diet quality early and reducing long term health risks. So, Canada's program specifically emphasizes access to nutritious meals and adherence to Canada's food guide. And it's supported by broader policy initiatives such as like the front of pack labeling for products that are high in sugar, saturated fat, and sodium. It also gives a preference for local procurement. They didn't define what local is. Like I'm thinking it could be like local to that province, local to that municipality, or even, local as in
Canada.
Canadian products, right? Because that's been really big over the last, I was going to say year, but it's more than a year now.
It's been a long time since I've been in school, but I think definitely something that needs attention. So I'm just really curious from an industry perspective, what's the opportunity here?
Yeah. So there could be procurement opportunities for the Canadian food industry from like an institutional procurement perspective for sure, especially for products that are lower in sugar, that are nutrient dense and aligned with minimally processed food principles, which could make it a great fit for some of our members. But there are a few challenges that our sector would face. The reality is that our sector's products can come at a price premium, and not all businesses are ready to scale to meet the demands of the school food programs. I would say that the biggest challenge is probably cost, because these programs operate on a very tight budget per student. So it
Mm,
makes it harder for higher cost products to compete, to be part of the program, even if they are aligned nutritionally. And then there's scale and consistency. So, as another challenge, schools need a reliable supply, which can be difficult for some smaller brands. But I think there are ways in. Brands can think about the total meal value. So, not just the price per unit. The way they can stand out is total meal value, right? If they can use one product in place of two others, then that's an opportunity. Products that improve satiety or replace multiple components. So a protein rich or item or like a high grain, high fiber item. And that could be an opportunity for it to justify the higher cost if the overall meal cost is still balanced out.
If I'm hearing you right, get a bit creative too, and maybe how you think about it if this is something that's interesting to you
Yeah.
as a company. Yeah.
Yeah, exactly. Partnerships are key. So distributors often a prerequisite for these types of programs. So without that, even strong products won't be adopted at
Considered.
scale.
Yeah.
And maybe starting regionally before scaling. So as I was talking about, like, maybe even at a municipal level, that might be the most effective path. It would take work for sure. There are challenges unique to our industry that are not seen across all of the Canadian food industry. But they would gain predictive volume and have national exposure as well. And if there are opportunities to align with a social impact initiative, that would be good for brands.
And just coming back to what you're saying, it's good it's headed in this direction because, like, get people while they're young into healthy eating. I mean, our industry is about healthy eating and longevity and thinking about your
Mhm.
health holistically. So I think even if you think about the long term for our industry, I know that maybe doesn't help brands right in the moment, but it's exciting and it's interesting. And I think, I'll sound very marketing here, but our goal is always to get more healthy living products into the hands of more Canadians. And so I'm a fan of anything that kind of takes it in that direction.
Exactly. And you can't deny the power of bringing a brand as to a nationwide, like, household recognized brand, right? Like
Hmm.
there would be a lot of power in that.
Definitely. Okay, so I want to move on. The last piece I want to touch on is food safety, but in a slightly different way, because I know there's some changes there that you've been watching.
We're seeing the definition of food safety evolve or
Mhm.
expand. So traditionally, it's been really about acute risk, so things that cause immediate harm, like a foodborne illness. And now there's more of a focus on long term cumulative exposure. So things like microplastics, environmental contaminants, endocrine disruptors. These
Mhm.
are becoming part of the conversation in a more meaningful way, and you're hearing about it a lot more often. It's really gaining traction globally. So the US is investing in research, Europe is already advancing their regulatory work. And in Canada, we're seeing signals around packaging intersection with environmental exposures. We've heard secondhand interest in the intersection between food safety and packaging coming out of Health Canada, particularly regarding the use of recycled plastics in food contact or like food packaging or things that contact food. But it's not just the policy signals either. I would say we are seeing real consumer concerns as well. I know we have some data that show that 33% of the EU consumers cite microplastics as a top concern, um, and this is a top concern just behind pesticides and food additives. So we know food additives is something that
Mhm.
has been for a long time now, right? Like, was something that was maybe seen as a trend or could be a trend. And then it was quickly realized, no, this is not a trend. This is a consumer concern that is here to stay. Within that same data set, it showed that there were a bunch of beverages sampled, I think 155 hot and cold beverages sampled and tested in the UK in 2025 that contains synthetic plastic particles. So
Wow.
this is just kind of highlights the ubiquity
Yes.
of microplastics in packaging and the urgent need for solutions.
Honestly, if I think even about the research that we did our 2022 Health and Wellness Canadian Consumer, and then we did our 2025 Health, Wellness, and the Canadian Consumer. And we asked people about like product attributes that they were thinking about with health and wellness. And going back to what you were saying about additives, like free from was the number one thing people were concerned about. But we didn't ask about microplastics in those particular studies. And I would say following news, following trends in this industry, and I think a lot about consumer kind of mindset, I can see why this is emerging now. There has been a lot of conversation, so it'd be so interesting to do that study again and add that in to see where it
Mm.
ranks within Canada as well. So all that is to say, I think it's really interesting that it's emerging and definitely something to keep an eye on. But I want to ask you, what do you think this means for brands right now?
Based on the data, it seems that consumers' trust in food safety, which now would include these things like microplastics, is declining a little bit. Looking at it, and it showed even in the UK, 67% of consumers were worried about ingesting harmful chemicals like microplastics from product packaging. So in this case, I would say brand awareness of consumer concerns and what the policy is kind of signaling is important, right? Having this understanding can be valuable. It means that the scope of oversight could be expanding as sustainability objectives drive increased adoption of recycled content. Regulators are facing more complex questions around the potential for contamination, migration, and in long term exposure risk. So they have to look at it, right?
Mhm.
It's not just about them looking at ingredients anymore. It's about packaging and supply chains and long-term exposure. So we're still really early. So there's nothing to happen from a policy perspective just yet. The consumer data is really interesting.
Mhm.
Um, I think it's just showing that we're going in a clear direction, right? We are going to keep tracking this one because the premise of it is really important, but it needs to be done in a way that doesn't put all the onus and burden back on industry and create red tape. So that's something that we want to stay aware of.
Yeah, definitely. Okay. So I think we covered all our topics. We have an episode. What's interesting across all of these topics, there is a common thread. We're, moving towards longer term thinking. And I love seeing it personally.
It's less about the immediate outcomes and more about sustained impact. And that's raising the bar for the entire industry. So,
Yeah, not
uh,
just about what a product does in the moment, but what it supports over time. So I think maybe that's where we'll leave it for today.
okay. Thanks for listening, and we'll see you guys next time.
Bye everyone.